Good afternoon, YouTube. This is Pylon 4553 coming at you from the depths of Northern Ontario, Canada. Today's show, we're going to be talking about post-traumatic stress disorder and what it means, how one gets it, and various other things. So let's jump right into it. This is a quote from someone that does suffer it, and they said that you wake up every morning to fight the same demons that left you so tired the night before, and that, my love, is bravery. Mental health problems are a difficult journey, and nobody should be discounted or stereotyped because of them. This is from a person by the name of Kimberly that is affected by this. 70% of all adults in the United States have experienced trauma. Of those adults, 20% will develop PTSD. Those numbers might be a little off, but I think they might be about right. What is PTSD? Well, the Mental Health Foundation defines PTSD, post-traumatic stress disorder, as a reaction to exposure to very stressful and traumatizing events. People who have experienced a very stressful situation can react in different ways and at different periods of time after the event. PTSD can be described as a normal reaction to abnormal event or set of events. Properly treated, the person with PTSD can start the path to recovery. However, recovery is likely to take some time, and some people continue to have residual symptoms which require ongoing support over many, many years. If it is not all bad news, many find that they have growth and matured through the experience. In my opinion, the road never ends. PTSD. Some people think that it's just people in the military or first responders. Well, PTSD is not just for veterans. Child sexual abuse and sexual assault are very common crimes, yet they are so stigmatized that they receive very little attention in the media from a mental health perspective. It is easier to report on a brave soldier coming home from war with flashbacks of violence than it is to admit that there are a lot of men and women out there, and I'm going to add to this, children out there that are suffering from similarly troubling symptoms that relate to their abuse or assault. This comes from a psychotherapist reporting in the Huffington Post in October of 2015. I went a little too far. Hold on. Where are we? I've gone too far. Just give me a moment. Not just doing it like that. Okay, there we go. Okay. It'll just take me a few moments to get this zoomed in. I'll go the other way. You don't have to be in. Don't need to have been in combat to endure a war. Child abuse from parents and others, being subject to prolonged sexual, emotional, psychological, physical, mental abuse, covert incest, severe neglect, scapegoating abuse from narcissistic and sociopathic caregivers, and pedophiles and with no one to trust is a war. Dealt with as a child, not as an adult. Some common symptoms of post-traumatic stress disorder are anger, irritability, guilt, shame, or self-blame, substance abuse, feelings of mistrust and betrayal, depression, hopelessness, suicidal thoughts and feelings, feeling alienated and alone, and physical aches and pains. Understanding PTSD. Let's just zoom this in. The causes: combat exposure, child sexual or physical abuse, a terrorist attack, sexual and physical assault, a serious accident such as car accident, that sort of thing, or natural disasters like hurricanes, tornadoes, asteroids. Symptoms: reliving the event, avoiding situations that remind you of the event, negative changes in beliefs and feelings, feeling keyed up and hyper. That's because of the natural fight or flight instincts. Normally, with a person with any type of PTSD from any source, they're going to be more keyed in on the flight aspect of the fight or flight aspect of their nature. The flight always wins with them. Um, so basically, if they're outside and they're having an anxiety attack or something triggered them, they might have saw someone that looked like they're an attacker or abuser. They might really have to go home or to another safe environment that they feel secure in. The treatments of these such conditions are CBT, that's cognitive behavioral therapy. It's considered most effective treatment. They meet with a therapist once a week for about 4 months. I haven't tried that myself. I'm not too like I don't trust therapy per se, but that's my opinion, not the opinion of many sufferers, just me. The cognitive processing therapy focuses on helping victims work through struggling with memories and thoughts of events. And those memories and thoughts can come at any time. Like you can be talking away to your best friends, and all of a sudden that thought pops right into your head for no reason at all. And your flight response wants you to get away. And it's not about your friends. They didn't they like most of the time they didn't meaningfully or knowingly at times trigger your uh, memory of the event. Sometimes you could be just sitting alone and the memories intrude into your thoughts. Sometimes daily. Sometimes every 10 minutes. It does this unpredictable the nature of when your thoughts are going to come to your mind. PET. That's prolonged exposure therapy. Learning how to deal with exposure to thoughts, events, feelings, and situations you avoid. I haven't tried that one. That's a new one to me. MDR, eye movement desensitization and reprocessing. Focuses on hand movements or tapping while you talk about the traumatic event. Rapid movements make it easier for the brain to work through the traumatic memories. That sounds like a very good idea. I might try that. Sounds it's mine. Medicines. Most of the time, it's SSRIs. That's selective serotonin reuptake inhibitors. These two medications are currently approved by the FDA. Citrulline and Paxil. There are more than that. I don't know how old this graphic that I took from Google is, but there are more than Zoloft and Paxil. There's there's ones that will significantly what's the word, target each uh, aspect of your PTSD, whether it's sleep, like that you can't sleep, or you're sleeping too much, your depression kind of component of your PTSD, your anxiety component of your PTSD, and if your PTSD does have obsessive compulsive disorder, it comes with it too, and there are medications that treat each individual event in your PTSD. Like we'll get to another graphic soon that will show more on the lines of the individual effects of PTSD. Post traumatic stress disorder. 8% of the American population suffer from PTSD at some point in their lives. 70% of the people who are victims of a traumatic event develop PTSD. 5.2 million adults suffer from PTSD every year throughout the world. That number is probably going to be higher. 20 of the 20 to 30% is the estimated lifetime occurrence of PTSD in combat veterans. And sometimes people don't want to admit they have this. They'll go to any lengths because of the stigma attached to this disorder. So maybe that could be another reason why these numbers seem a little low. What is a traumatic event, you might ask? Well, war, physical assault, natural disaster, child abuse, accident, sexual assault, and or witnessing any, like you could be like on the sidelines of war as a civilian in it. That's a traumatic event for you, watching the war. Physical assault, like you might be walking down the street and you see someone get attacked. That's a traumatic event for you as well because you witnessed it, and it depends on how your mind perceives it. Natural disasters, that's like you're in a natural disaster, you're a participant whether you like it or not. Child abuse, like yeah, as a child, it does affect you, but also like when you're talking to somebody about it, like if it happened to you, when you're talking to someone, they might be affected by your story, your thoughts, your feelings on it, and that could be because like in with PTSD, even first responders such as police officers, paramedics, firefighters, your doctor, your nurses at the ER, the hospital, your family doctor, your psychiatrist, if you have one. Any number of those people will and probably will get in their lifetime PTSD because it's the nature of the things that they witness. Sometimes, sometimes it like you can witness the same event over and over again, or experience the same event over and over again in your lifetime. But at a certain point, no matter what condition your mind is in, it will take its toll. Like some of the first responders you talk to, they'll be the first to say that they did not think that this job that they went into affects them as much. It would affect them as much, but then they come out of it a totally different person. Same with war. The same with the combat veteran. Same with the military person that's not in a combat situation. Like he might like be traumatized by all the situation around him. That's the same with all of us. All of us could be affected. And sometimes some of us don't even know it until one day we just crack under the pressure of it. And that sounds like I don't want to use crack under pressure, but your brain can only absorb too much, and it's got the processing. It can process it here, it can process it there. Everything, it puts it in the memories. Whether you can recall those memories tomorrow or 20 years down the road, like it takes time for those memories to affect you. It could affect you instantly, and you're traumatized for life. But sometime in the future, you might be sitting uh, alone or with people anywhere, and suddenly that memory that maybe you've been thinking about, you think about it all the time. No big deal. Then all of a sudden, your view of that memory changes under no fault of your own, and bam, every time you think of that memory, you either cry, you get angry, you get frustrated. All the emotions that are under the that you can experience, you can't experience them under when you're suffering from PTSD. Like, and sometimes the regulation of those emotions is difficult with PTSD. Like, you could be happy talking to your friends, and then they go off to do whatever they want, leaving you in that section of the place or wherever you are for even a millisecond when you have PTSD. Then, like, yeah, you get left alone with your thoughts, and bam, your whole day is ruined. Over no fault of your own, you thought of the bad thoughts that affect your mind, hit you, and you want to go home, or you want to go see a person that knows how to calm you down. Symptoms of PTSD, as I just covered upon, some of them are depression. That one's the worst. That one is one of the worst because it brings your mind down so far that you're always sad, you're crying. Like you don't even want to do anything at times when your depression is bad. Like it's the amount of things that you could fit into the depression category of PTSD. Uh, I don't think there's enough space on YouTube for me to discuss all that. Um, flashbacks. Flashbacks can happen at any time of day when you suffer from PTSD. Flashbacks can take you close your eyes for just a second and you're transported back to whatever event that causes you the most problems. Guilt. Guilt can be like a really bad situation. It could like guilt in itself is like um at some point, like if you're in a like if your experience, you experienced guilt. Like why did it happen? Why did it happen to me? Is it my fault? Should I take the blame for it? Um, if you're looking at it from like a first responders uh, like space, they probably would tell you their guilt would be like, if only I got there sooner. Why did that have to happen to that person? Uh, did something I do in treating the person, or any time that I got delayed by treating the person, did that affect them, the victim of it? Sometimes you hallucinate that you're back in the event. Anger is like you're angry at everything at times. Like you could be sitting there, you stub your toe. That might seem nothing to some people, but sometimes when you're affected by PTSD, you are going to get angry. You're going to get cranky. You're going to get irritable. I'm still struggling with that myself. For the anger and the irritability and the crankiness. Insomnia. Insomnia is a big factor. Like sometimes you just want to avoid it all sleep. Sometimes it avoids you, but sometimes you have a nightmare flashback during your nightmare, and you wake up and you don't want to go back to sleep ever, and that will in turn uh, increase your depression level. It'll increase your guilt level. It'll increase your anger level because you're sitting there thinking, why am I letting this affect me? These sorts of things don't affect everybody else. Why am I any different? Those things I can't answer. I can't even answer that about myself. Memory loss. Like I find with memory loss, my memory loss like seems to involve most of the memories of good times, and like I don't know if this affects the same with everybody else, but the I don't have memory loss for any bad situation that's ever happened to me. Not one. Drug use. Drug use is the way to escape, whether it's prescription drugs, over the counter drugs, illegal drugs. Even though you're coming out with that uh, marijuana could be uh, a very good drug to help PTSD people. But they're also saying that marijuana does cause anxiety, that sort of thing. Yes, certain strains do certain things. It's like you're not gonna. Uh, you're not gonna. Let me try to figure out where I was going with this. Well, like let's say you're not gonna like with the like each strain is like a piece of silverware. You're not gonna try to cut your steak with a spoon. Different strains do different things. That's and the thing is, at this point in time, we do not know enough about marijuana, and PTSD. It's all experimental at this point because we've lost the last 70 years because of the drug war on it. Post-traumatic stress can occur acutely soon after the trauma or in delayed onset, months, years, sometimes even decades after. Like in my case, I was affected, I could say, all through the abuse, all through the events. But at that point, I didn't know that anything was different. It only, like, I finally got help in '96, but I I think it was '92 or '93 when I actually stopped the abuser. Not physically, but well, you could say it was physically because I dropped all contact with him. And between that time and, and the time that I got excuse me, between that time and the between that time that I stopped it and the time that I started getting treatment for PTSD, that was a confusing time in my life. I would hide out from everyone. Sorry. I'd hide out from everyone. I would not. I stayed in my apartment at the time. The only time I'd go out. Just give me a moment here. Okay. Hopefully that coughing spell is gone. I wouldn't go out unless I felt safe. Nowadays, just think that this is 20 plus years after the first incidents with PTSD keeping me like a social pariah. I still can't go out often feeling safe. Even though I'm a big man, it's not. When people with PTSD say that they're looking for a safe place, it doesn't mean that they're weak. They're just trying to protect themselves from being affected more by the things they can't control. Like, It's hard to explain like how it is in a way, but you sometimes you can't control like conversations with people. You can't control this. You can't control that. And when you have PTSD, it's not like when you were before you had PTSD, like that you can let some things slide off your back. When you have PTSD, you could just talk to the person, the same conversation day in, day out. You don't know when one word, unbeknownst to either of you, might trigger you and put you in a downward spiral. Downward spirals usually involve self harm, self preservation, like hiding oneself from people. You don't know. And like it takes a long time. Like this is why in the like let's say the Me Too environment where people are like saying the women are basically liars for not coming forward right after they were assaulted or abused or raped or whatever the situation is. If they didn't come out right away, that means they're liars to some people. No, no, this is far from the truth because they they you could say they suffer from PTSD in a way. They could, in my eyes, you can. Doctors might not. I don't know. Counselors might not. But it takes a long time for you to feel comfortable about being in that situation that the other person puts you in. It's not going to be easier right after the moment ends. Not in an instant. I still haven't even came forward and talked to people to have charges being brought against the person that abused me when I was a child. I'm still not comfortable doing that. It's not because I think what he did was right, or it's just putting yourself in the spotlight on this. And even if the courts protect your identity and only the accuser knows who you are, that's still not going to affect how you feel. It's not the spotlight like I don't think like being in the spotlight doesn't mean just being in front of millions of people with it. Your spotlight could be just the first responder that you talk to about your event. The first responder, whether it's your counselor, your doctor, a police officer, your psychiatrist, your therapist, even family and friends. It's hard to tell them, no matter how long it's been since the abuse or the attack or whatever. It is not easy to come forward. Those people that think it's so easy to come forward don't know anything. It's not easy at all. It's not like turning on a light switch and saying, oh, there's light. Here we go. We can talk about this. No. Even when you're sitting in a room full of light, your PTSD and your trauma and all the essence that affects you about PTSD they keep you in the dark. Your mindset, your inner voices keep you in the dark. Your inner voices are your worst critic. With PTSD, sometimes, in my case, I have this most severe inner voice that, like, I'm pretty sure that most people that go through my situation, their inner voices will be as severe as mine, if not severer. What I mean by that is, uh, when when you say, like, you look in the mirror as an average person, you might say, "Oh, I don't like the way my eyes look," or like if they were just a millimeter to the left. That is kind of normal. I'd say normal inner voice. Like you're critical of yourself. But when you've got trauma in your head, like based on like PTSD and your own abuse that you suffered, your inner voice is exponentially louder. You don't have your nice voice to say, "Oh, you look pretty good today." The, the only voice you can hear is the negative one. And that negative one prevents you from going to seek help by getting the person that assaulted you or abused you or raped you or whatnot. That inner voice keeps you from going to get justice for the crime that was committed against you. That inner voice will not let you. Like, like you have to fight against that voice every day because that voice tells you things like, "No, no one's going to believe you. You're nothing. You're lower than nothing." Even if the person that abused you is rich, middle class, or poor, your mind will tell you that they're going to be believed more than you. I don't like, even if I was a rich person, I don't think money would make my mind tell me that this guy who would probably be poorer than me in that situation, my mind would tell me that they would believe him more than me. That's how your inner voice keeps you trapped by it. There's no easy way to fix it. I've tried. I've tried drinking. I've tried medications. I still am on medications, but I don't know how to fix it. But these women that come forward after all this time, I have uh if it's as bad as what they say in the Hollywood circles, it is. I believe these women because I know how it feels to want to try to come forward or want to come forward, and you have this inner voice that tells you, "No, they're not going to believe you because of this, that, the other thing." These women are, uh, what's the word I'm looking for? Uh, they, I might think of a better word later, but what I think they're heroes for wanting to come, for being able to come out. Everybody that is affected by something like this, that has been abused, raped, or whatever, that needs to come forward. They want to come forward. They want to get justice for themselves, make sure that this doesn't happen to the next person, or whatnot. It's not that they didn't want to come forward, it's just that they were trapped in their own mind for all this time. These are some of the things that happen in a PTSD mind. As you can see by the thing, or the image on the screen, this is what could go into your, and it's got some of the what happens after, some things are before, some things are during, some things they are like what happens after, like the therapy, and the assistance and the support, and you can read things in a book about it. Understanding PTSD. This little scene, you have the traumatic event goes down to the memories of the trauma, your present, your vivid images, your fragmented thoughts and sensory perceptions of it. Current sense of threat is what I was talking about earlier: the fear, the disgust, and the shame. The beliefs about yourself or another part, yourself, the trauma, the world, how the world will view you, how the world will treat you, your future, other people. Will they treat you out of fear, disgust, or shame? That's the problem, like your inner voice. The coping strategies usually involves avoidance of everything that affects you. And like that doesn't help with your internal beliefs about yourself, your trauma, the world around you, your future in the world around you, and other people's thoughts about you. Like some people might say, don't worry about everybody else's thoughts. One of the things that goes on in your mind, you keep playing these things out. It gets hard not to think of how other people might react to you. And that's the run into the smoke. Don't you hate that when that happens? You flip your cigarette around in your hand so many times. Then when you go to light it, you got the wrong end in your mouth. That's one of my things today. On the next thing, there's the fact that not all wounds are visible. That couldn't be the most strongest stating about PTSD, because PTSD is one of the worst injuries that you can get, with the exception that it's not visible. Like you might say, well, somebody losing both legs, that might be worse than PTSD. Yes. The thing that I said was not visible. You look like a normal person with PTSD when you have PTSD. Some people look at you and say, "Oh, that guy is normal. He's just like me. Looks like just like me." But inside, that person might be the most traumatized person that you'll ever meet. Just remember, not all wounds or disabilities, for that matter, because PTSD is a disability, Not all disabilities or wounds are visible. Here's a quote from the person. Sometimes I think the curse is gone. Days or even months pass in peace. But then, without warning, it stirs and surges through me, like a recurrence of malaria. And my mind is fevered, infected with your sickness. My sweet smells of old terrors. Oh, sorry. My sweat smells of old terrors. My body is a frightened animal. The cruel voice in my head, striking hammer blows, is yours. You reach from the past and bruise me. That quote is from John Mark Green. I don't know what The Traps Part 2 is. It could be a movie, it could be a book. Maybe you should check them out. So, strategies, things that are not helpful with when dealing with a person with PTSD. Avoid saying, you shouldn't feel this way. We already know that. Thank you, Einstein. That's a big help. But we know we shouldn't be feeling like this. Our trauma is not today. We know that. We know the event is not happening today. And if it is, then we need to get help out of that situation. PTSD like will not let us go will not let us let go of the past. And somebody telling us that, it's like, oh, you hurt your knee. Well, maybe you should walk it off. I need to get over it. If we could, do you think we wouldn't? Nobody wants to live in this hell that we the PTSD people live in, that constantly affects us in ways that we can't control. We'd love to get over it. Do you have any constructive criticism on how we can get over it? It's not that big of a deal, really. So if you stub your toe, or actually if you break your foot, and me telling you that is not a big deal, go walk it off. How are you going to feel? Grow up. Yes, we would love to grow up, but we're trapped in our own minds with memories we don't want. It's not as simple as telling us in a stern voice to grow up. Wow, this one, I don't even want to touch on that one. That person that said the next one on that list after grow up, you can read it yourself. That person. If you have any friends that say that sentence to you, the only answer I'd give them is fuck you and move on without them in your life. No one should be telling you that, even if it's a joke. That is a serious no-no for anyone. Anyone, anywhere. You should not tell somebody that. Actually, the next two ones on the list, they walk away from those type of people that talk about that or even joke about those sorts of things. And if you see those persons, if you're affected by PTSD, Ignore these people. These people are not your friends if they tell you these three things. Do not, like the bottom three. It's easy to slough off the top three or four, but the bottom three, don't even deal with these people in your life. And if you're the type of person that has a PTSD friend, and you tell your PTSD friend these three things, please change your attitude about the person that you're talking about. They are not bad enough. I don't care who you are. You could be a, the biggest asshole in the world. Those three comments stating to that, like, if you're claiming to be this person's friend, these just are unforgivable. If you don't want to see the person, let them know that you can't handle it. Try not to be an asshole, but don't say these things to them. Whatever it is, like causing you to say these things about to them, because they don't need that. Like, even I can't even read those comments. Avoid yielding to the idealization or taking sides. You have to be diplomatic and try to see it from the person that's being affected by it. Like, try to help them as the best you can. To them, you might be their only friend. Or they're their only friend they could trust. Try to be diplomatic with anything you say to them about this sort of thing. Avoid getting excessively close. Yes and no. Depends on your meaning of close. They might need you as a shoulder to cry on. If you're willing to if you're willing to have them use your shoulder, that's fine. And some things of these I don't believe are suited for this sort of thing. But never tell people that like and the worst things. The worst thing I was told just recently was, I don't know how you got on it, like because meaning disability. I know people that have it worse than you. Oh, really? Just because my disability is invisible and your person's disability might be visible. Each disability is classified on its own scales. Like, just don't put the person down, whatever the conversation. Like, I know some people do have it bad than others, but this is not a competition of whose disability is bigger. No, far from it. Each person is an individual, not a collective of disabilities. Each person's disability affects them differently. Like, some people, I've known disabled people all my life. Like, there were disabled people that just went with it and said, well, there's nothing I could do. I might as well just do what I'm to do. Blasé about it. There were some that were, and God rest her soul. This one, she's always on my mind from the past. She would always try harder, do things at least better than was expected of her. Like, she was a great person. And I only wish I had known her when I was more mature in life. And that's all I can say about that. But back when I was a teenager, I wasn't very mature. It's not the person. It's not that the person is refusing to let go of the past. It's the past that is refusing to let go of the person. And his true words have never been spoken. I gotta zoom in on this picture. I think basically we've covered that stuff. PTSD impacts the spirit, the soul, mind, emotions, the memories, and the body. There's the event that's situated right at the top. The pain associated with the event, whether it's physical or mental. The guilt that comes from being in the event. That we've already touched upon. The shame. Even if you did nothing wrong in the event and it was not your fault, your mind is going to still give you some shame over it. Like, shame, why did I let it happen? Why did I didn't do anything better? That could be that. This goes hand in hand with the guilt. The shame part is that you're ashamed of the you're ashamed of what happened to you. You're ashamed of how you process it in your head, and sometimes you're ashamed of how people can think of you based on your guilt, what your event was. Then we go into the next box with anxiety and fear. Those are big ones. Anxiety is that uh, anxiety is a hard thing to describe, but it's like it leaves you sweating. It makes you feel like you're still there, or worry about the future, worry about the past when you can't control it. The fear of it happening again, the fear of people finding out even though it wasn't your fault. The anger and the resentment is in a box of its own. Anger towards the person that made you feel this way. Anger towards how you were affected by it. General anger, resentment. Why did I ever meet this person? Why did I? In the case of like PTSD for uh, first responders or military, their resentment was, why did I put myself on the line? And this is what happened to me. that sort of thing. Resentment, why did I sign up? I didn't know this was going to affect me this much. The next one is depression. Depression is a heavy one. That one, there's lots of these the pentagons on the screen right now are heavy. Well, they weigh heavy on the PTSD mind. What is a traumatic event? Out of 100% population, 70% suffer from PTSD after a traumatic event, witnessing death or injury. Physical assault, whether it's armed robbery, rape, physical violence. Combat is a big part of it. Sexual assault is car accidents, whether you're the person behind the wheel or you're the person that was hit by the other person. Natural disasters and child sexual abuse. Types of trauma. Oops, I went too far. Big trauma. Serious accidents, natural disasters, robbery, rape, and urban violence. Sometimes you can get trauma from having to go, undergo major surgery or life-threatening illness. Chronic or repetitive experiences, for example, child abuse, neglect, sexual abuse, war, combat, concentration camps. So it's like you could be on the opposite end in the war, like to have trauma. May cause PTSD in some people, but not all. The small t's, trauma, overwhelming but often not as seen as traumatic. These might be uh, based on interpretation, and sometimes interpretation, like all, it depends on who's interpreting it. Emotions, beliefs, and physical sensations occur in both the mind and body. Unprocessed traumas have a long-lasting negative effect. Can cause concentration and self-esteem and emotional regulation difficulties. That one is like a good topic right there. Emotional regulation difficulties. I suffer from that. Some days, sometimes I could be so happy, be happy, and all of a sudden I'm the opposite. Sad, crying, or trying not to cry. You have no regulation. It will flip like a switch on the wall. Flip. There you go. It also stunts and colors later perceptions of the thing or the event. Often no intrusion of imagery. That one right there means like your event doesn't come flashing back to you like a bull in a china shop. Even though, speaking of bull in a china shop, that saying was busted on Mythbusters, but like the thought still counts of that saying. Most common in neglected and abused children. Become part of a negative spiral when a big T trauma occurs. Sometimes referred to as complex trauma. We'll get to complex trauma later, and we'll also get onto complex PTSD, which are totally different. Trauma, any event beyond a person's ability to master at the time. A person may withstand a big trauma but be so weakened that it is a small T trauma that finally causes his or her coping abilities to collapse. Naming small T experiences as traumatic and validating them aids recovery. The biggest part of PTSD, I find, is making you believe that people will validate and believe what you're saying. Like that goes back to the inner voice. When the inner voice tells you that you're a nobody and people won't believe you, like when somebody does, it's a relief, even if you don't believe that they believe you. Okay, and we'll move on to the next one. Stress. Stress is a big component of post-traumatic stress disorder. Uh, we'll zoom in on this one. Medically proven stress contributes to heart disease, strokes, high blood pressure, colitis, irritability, rheumatism, depression, migraines, diabetes, hardening of the arteries, insomnia, fatigue, sex problems, skin diseases, allergies, overeating, asthma, kidney disorders, ulcers, breathing problems, and increased smoking. Trauma. Let's break down the word trauma. The traumatic experience, re-experience in your own mind. You avoid things that remind you of the event, or even perceived avoidances. Like, let's say you just avoid going out just to avoid people, because even just seeing people could make you feel worried and whatnot. Unable to function, that's a big one. Because sometimes when your PTSD gets so bad, you're unable to function, whether it's your self-care, like bathing, your clothing, your even as simple as brushing your teeth. You can't function as a normal human being. You cannot leave the house. You're like, you can't do this, you can't do that, because your depression, your all the little details inside the big word PTSD prevents you from doing this. It lasts at least a month, and the arousal component. That one is the fight and flight. That one is the kicker. What is PTSD and trauma? Physical physical symptoms of PTSD include gastrointestinal issues, colitis, heartburn, changes in appetite, whether you eat a lot or you eat nothing. And could be in between. Headaches, unrelated to vision, sinus, fever, or other. Body aches. Actually, going back to headaches, it could be because you're always on the edge. You're afraid that something bad is going to happen to you. That could be why you keep getting headaches when you have PTSD. Body aches, muscle and joint pain, inflammation due to the brain, releasing cortisol and other inflammatory hormones, chemicals to as the brain tries to protect itself. Insomnia, and chronic sleep depression, not related to other issues, i.e., caffeine apnea. Insomnia is when you can't sleep because, like, one thing, like your brain is keeping you too awake to fall asleep. Chronic sleep deprivation is also part, in my eyes, part of PTSD because you're avoiding sleep. You're afraid to go to sleep. You're afraid of being trapped in a nightmare. The nightmares are as like sometimes every dream, and sometimes you can go through weeks or days without one. Vision and hearing heightened sensitivity periodically. Uh, that means like you could suffer from hallucinations. Sometimes it's naturally occurring hallucinations, or it could be uh, hallucinations caused by your drugs they've got you on to manage your symptoms. These symptoms cannot be explained as being caused by an existing medical condition or physical disorder. This is why PTSD is often misunderstood and misdiagnosed or even dismissed as a condition. These are the facts about PTSD. Let me just zoom in a bit. What is PTSD? I know we've been talking about it for quite some time now, and I thank you for being here and listening to my rambling on about it. Is a mental health condition that's triggered by a terrifying event, either experiencing it or witnessing it. Many people who go through traumatic events have difficulty adjusting and coping for a while, but they don't have PTSD. If the symptoms get worse or last for months or even years and interfere with the functioning of normal everyday life expectancy, it is most likely PTSD. Intrusive memories, recurrent, unwanted, distressing memories of the event. Reliving the traumatic event via flashbacks, nightmares. Upsetting dreams about the traumatic event. Severe emotional distress or physical reaction. Negative changes. Negative feelings about yourself or other people. This is why this goes back to what I was talking about the Me Too from the Me Too event that goes on, like the people and like people coming forward talking about their abuses, because your negative feeling about yourself and other people prevents you from doing normal things or everyday things. Inability to experience positive emotions. That is true. Feeling emotionally numb, that you're either happy or depressed. You're just sometimes you can experience, in my eyes, like you can experience all the emotions in one day. Sometimes even in the same hour. Lack of interest in activities you once enjoyed. That's a big one. Let's say you like to go to the movies. Once you have PTSD, you might not have interest in it anymore. Or like you just don't can't be bothered with doing anything like that. Hopelessness about the future. Memory problems, including not remembering the traumatic event. I like to not remember the traumatic event, but Some people, they can't remember it, but PTSD affects them. Difficulty maintaining close relationships and friendships. Oops, where do we? There we go. Sorry about that. Once I get more in tune with the software, like to do this, I'll be better. Young children who are experiencing PTSD may have other symptoms like bedwetting, forgetting how to being that one. They might forget to know how to speak and like what, or they can't stop talking. One of the two, and you can have one of the, or either of them that I described. Acting out in the event in playtime, being unusually clingy with a parent or an adult. Avoidance, trying to avoid thinking or talking about the event. Avoiding places, activities, or people that remind you of the event. PTSD also changes you emotionally. Irritability, angry outbursts, or aggressive behaviors. That that one some people have a problem with. That one gets the most news because like in cases that they in crimes they go, well, the person suffered from PTSD and that's why he couldn't control it. That one I fight to control all the time. I'm whenever I go out, whenever I'm talking to people, I close up. I try not to be irritable with people. I try not to have angry outbursts in public or aggressive behavior because I find that it's like you have to treat the people like like how you'd expect them to treat you. You can't be angry with everybody. You can't be aggressive towards people, or you can't be irritable with them. Like I work occasionally when they can manage it in a retail environment. You can't let your irritability show in that situation, or you're not going to have a job. Let's just put it that way. You're trying your best to have maintain a face of civility in public. That's the hardest part of my life. The going out is trying not to let people know that I like something is irritating me. Like that's kind of why I can't do a lot of work because it's harder than the job itself. Trying to maintain civility while you're out. Like, sure, like you might flip out because somebody cut you off in traffic. That's normal. That is everything. But you can't like just like somebody rubs you the wrong way. You can't let them they know that you're irritated or like it's a long like hard topic, but like if you have PTSD, this is the biggest thing you have to work on if you want to go out and because they I don't want to give people irritability because they'll end up giving it back to me. And when I get emotions back, that makes them 10 times worse. Like I try to maintain a stable, when dealing with people. You're always being on guard for danger, overwhelming guilt or shame, self-destructive behavior like drinking, doing drugs, cutting, that sort of thing, punching walls. Like a few times I got so pissed off in my life, I punched walls because I don't want to punch people. Like I punched a wall one time. I forgot that was an exterior wall of an apartment building. The hand was so blue afterwards. But moving on, you sometimes have trouble concentrating. You have trouble sleeping. You're easily startled or frightened. Facts and numbers. About 5.2 million adults suffer from PTSD during a given year. About 7 to 8% of the people in the U.S. will have PTSD at some time in their lives. About 10% will develop of women will develop PTSD in their lives compared to with only about 5%. Some of these numbers might not be accurate. About 30% of Vietnam veterans experience PTSD. Probably the number is higher in that case because among military people, they want to remain strong in the eyes of other people, and the stronger the person wants to feel, the stronger they are to try and hide this condition. That's why I say the numbers might not be accurate. About 11 to 20% of the veterans of the Iraq and Afghanistan wars experience PTSD. Again, those numbers might be different. They might be wrong because of the stigma attached to PTSD. And here's another quote. Domestic violence can cause PTSD as well. If you're experiencing intrusive memories, avoidance and numbing, increased anxiety, hyperarousal, lack of focus, trouble sleeping, PTSD, or nightmares, please see your doctor for further support. Here's another quote. Wounded children have a rage, a sense of justice that burns in their souls. What do they do with that rage? Since they would never harm another, they turn that rage inward. They become the target of their own rage. They repeat in their thoughts the same harmful words that were spoken to them. They must lash out, but the only ones weak enough to attack are themselves. Post-traumatic stress disorder. Early warning signs of PTSD. Re-experiencing the trauma through repeated flashbacks or nightmares that cause distress. Avoiding places, people, and activities that act as reminders of the trauma. Increased sensitivity to the point of losing focus, insomnia, and increased irritation or anger. Symptoms of PTSD: anxiety, hallucinations, flashbacks, insomnia, nightmares, loss of focus, depression, sudden agitation, and guilt. Actual symptoms may occur several months or years after a traumatic event has happened. PTSD facts. The symptoms of PTSD usually develop during the first month after a person experiences a traumatic event. However, with some people, there may be a delay of months or even years. Of those who experience a traumatic event, it is thought that 30% of them go on to develop PTSD. The main four types of symptoms are re-experiencing. This is where a person relives the event in a form of a nightmare, flashbacks, or sensation, such as a smell or sensation of the skin. Avoiding certain people, places, or circumstances that may remind you of the traumatic event. Hyperarousal. Feeling that you're constantly aware of threats and feel quite jumpy, easily startled. This leads to angry outbursts and periods of irritability. Emotional numbness. Some manage their feelings by trying to feel nothing at all, by becoming emotionally numb. Because becoming emotionally numb, you will talk less with your family and friends, who then find it hard to live or work with you. 10 symptoms: nightmares, poor concentration, poor judgment, guilt or survivor guilt, avoidance, isolation, insomnia, irritability, frustration, rage, negative self image, anxiety, depression, apathy, and communication problems. PTSD is not a mental illness, it's a psychological injury. How does your brain change with PTSD? Well, for one, your hippocampus shrinks. This area helps us distinguish between past and present memories. Increased activity in the amygdala. I always have problems with that word. Um, amygdala. You can read it on the screen. Help us process emotions and is also linked to fear responses. Ventromedial prefrontal cortex shrinks as well. This region regulates negative emotions that occur when confronted with specific stimuli. These changes in brain chemistry are the reasons why only treatments such as EMDR and CBT can fully reverse the effects of PTSD. There's some more symptoms, which we probably already covered. Now we get on to the subject of PTSD and complex PTSD, which are two entirely different disorders, and that needs validating. So please do not refer to complex PTSD as PTSD. And some more symptoms. Zoom in on that one, see what that one says. Okay, here we go, zooming in. That seems like a good number. Okay, the differences between PTSD and complex PTSD. One or few traumas under PTSD. Under complex PTSD, there are chronic, inescapable traumas. Both suffer from flashbacks. Under PTSD, you have an exaggerated startle reflex. Under complex, you have no filter and are easily overwhelmed. Avoidance of certain things trigger or evoke or suggest trauma memory. That was one of my comments earlier, that it doesn't even have to be the same. Like, you could be talking about something totally different, and your mind will suddenly bring you back to that traumatic experience. Under complex PTSD, you suffer from social isolation, avoidance of relationships. Under PTSD, you have nightmares about the trauma. Under PTSD, you have night terrors and chronic insomnia. Night terrors, they can include feeling or hearing things in the dark, having to live with a light on at all times. There's many others under night terrors, but for brevity, I'll just cover on that what I've just said. We could talk more about that in future shows. PTSD, you have some dissociation, may include dissociative identity disorder. Complex PTSD includes fragmented sense of self and dissociated uh, identity disorder. Under PTSD, you have hypervigilance. Under complex PTSD, you have hypervigilance, some ideas of reference, preoccupation with the abuser, anxiety and depression under PTSD, and you have under complex PTSD some alterations in affect regulation. Oops, I went too far. I think that's the next one. Oop. Okay. Complex PTSD, complex post traumatic stress disorder, disassociation, memory disturbances, i.e., time loss, blackouts, amnesia, fugue episodes where you can't remember what you did, perplexing fluctuations in skills, habits, and knowledge. That I take to mean, like, you know how to let's say you know how to cook, but you can't cook the one day. You can't keep your skills and habits and knowledge from day to day. They come and go. Fragmentary autobiographical recall, source amnesia, disassociation under process symptoms, depersonalization, derealization, passive influence experiences, auditory hallucinations. That's when you can hear the person's voice and they're nowhere in the vicinity. Or that's my opinion, or my interpretation of that. Trance like states that you're kind of sleepwalking, but you're not. Alter personality states, fugue and DID. Switching behaviors. Healing from complex trauma and PTSD. Many child abuse and complex trauma survivors have been manipulated into tolerating abuse. One of the vital healing needs is to understand we do not need to tolerate abuse, toxicity, or harm. And this includes intentional, non intentional, covert, overt, and passive aggressive toxicity. Our healing, our emotional health, and general real well being depends on us placing boundaries to protect ourselves. It does not make us nicer, better, or kinder, or more compassionate to tolerate toxicity. In fact, tolerating toxicity is detrimental to both the survivor and the perpetrator. This was a quote from Lily Hope Lucaro. What is complex PTSD? And here we have a little umbrella-shaped device. It's difficult to regulate emotions, for example, self-harm and rage, and happiness, depression, and whatnot. Altered attention and consciousness, dissociative amnesia, somatic distress, e.g., headaches and nausea, hyperarousal or being on the edge, irritable insomnia, PTSD, avoidance of reminders, triggers, and PTSD, flashbacks, nightmares, reoccurring experiencing, belief systems affected, e.g., for example, the loss of faith, the self of yourself. That means you don't know who you are anymore or what you become. Difficulties in relationships and withdrawal and happiness or helplessness. Difficult to regulate. Oh, we ever covered that. Sorry. That's the problem with the circle. You come around and you can keep going. My PTSD by a poem by L. N. Preston. How am I supposed to feel when the nightmares and pain become too real? What am I to say when all my hope has gone away? Where do I go when life passes by and all I want to do is die? When do I get the choice and quiet the endless voice? Flashbacks, isolation, and hypervigilance abound. Peace and calm can't be found. The grim reaper scares me not. I live in hell, and I fear him not. PTSD, I'm the walking dead. I'm stuck with the memories inside my head. What we'd like our family members and friends to know about living with the PTSD. 1. Give me the space when I need to be alone and don't overwhelm me with questions. I'll come and talk to you when I'm ready. 2. Number 2, get away from me if I'm out of control, threatening, or violent. Number 3, be patient with me, especially when I'm irritable. Number 4, don't personalize my behavior when I explode or get quiet. Learn to and rehearse a time of process. Don't patronize me or tell me what to do. Treat me with respect and include me in conversations and decision making. Don't pity me. Don't say I understand when there's things that you cannot understand. Realize that I have unpredictable highs and lows, good and bad days. Anticipate my anniversary dates. Recognize that these could be tough times. I'd like to share my traumatic experiences with you, but I fear overwhelming you and losing you. I want to be close to you and share my feelings, but I'm afraid to, and sometimes I don't know how to express my emotions. I also fear your judgment. Know that I still love and care about you, even if I act like a jerk sometimes. Don't ask me to go to a crowded or noisy places because I'm uncomfortable in those settings. PTSD. There are wounds that never show on the body and that are deeper and more hurtful than anything that bleeds. Don't wait until you break. PTSD is a normal reaction to extreme trauma, just as bleeding is a normal reaction to being stabbed. And when going back to the marijuana and PTSD, the majority had a more than 75% reduction in symptoms when compared to when they were not using marijuana. Let's zoom this one in, and I believe we're coming to near the end. If you're still with me, I thank you. Another poem by Lily Hope Lucario. You can be doing okay, but all it takes is one trigger and horrific memories flood your head, and your whole world comes crashing down around you, and everything becomes black and painful again. Next time you hear about someone having PTSD, remember it's not a choice. It's the result of trauma, something nobody chooses. When you see someone in your life or your friends or family that are giving you silent help signals, you need to learn and figure out how people silently ask for help. Let's zoom in on this one for a moment. This is just explaining what happens and how you need to the actions you need to take at each phase of the constant. I want you to care about PTSD as well. Keep calm and raise PTSD awareness. Stop the stigma. And that's the end. I hope you enjoyed this presentation. Basically, we'll touch upon these topics in future live stories and live podcasts. This was just an example, like a educational story, like show to assist you in understanding the things about PTSD. Some of my top comments might have rambled on, but it's okay because, like, we are human. We're all human. Even people with PTSD, even people that don't have PTSD or every other disability out there is all equal. No one's disability is worse or great in the eyes that it's an individual case by case that you should judge a person based on their disabilities or their abilities. Don't just assume that because what you see on the outside is different from or the same as you, that they're not different or disabled. Like, people with hidden disabilities such as PTSD deserve the same care and understanding and compassion that you would give someone in a wheelchair. Like, we both have our individual disabilities. A person in a wheelchair does not have mobility. They could also have other considerations on the inside to worry about or consider. Like the person walking down the street next to you. He might look or she might look normal or might look not disabled, but inside they could be suffering from anything that, and you got to treat people with the same respect no matter how you perceive them. Uh, just because a person is disabled if they're in a wheelchair doesn't mean a person that has is afflicted by PTSD or anything invisible shouldn't get the same respect that you would give the person in the wheelchair. I'm going to end it here. I thank you for listening. Leave a comment, leave a question, leave a concern, like, subscribe, or if you didn't like this topic, please don't hesitate to thumb it down. Thank you, and this was for Pylon 4553 on YouTube. Have yourself a great YouTube day.